Young adults have worse kidney transplant outcomes than other age groups. Subscribe to the channel. Young adults with renal transplant face many pressures: establishing sexual relationships, increased responsibility for their own healthcare and independence from the protective influence of their parents. Risk-taking behaviors are high in this age group, with levels of non-compliance 4 times that of adults. The objective of this study was to establish if renal transplant outcomes, graft and patient survival, for young adults in England were worse than for other age groups. This was a retrospective, observational cohort study performed on UK National Health Service data. Outcomes for all renal transplant recipients in England, 26,874 patients, were collected from hospital episode statistics and the Office for National Statistics databases over 12 years. Primary outcome measures were graft failure, defined by dialysis more than 6 weeks post-transplantation, graft removal, retransplantation or death. Survival analyses were performed by the generation of Kaplan-Meier curve estimates, and a Cox regression analysis was performed for time to graft failure. See the baseline characteristics by age groups. Young adults between 14 and 23 years of age experience a return to dialysis at a much higher rate than any other age band. When combined outcomes of death, retransplant and return to dialysis are considered, the young adults again have poorer outcomes compared with 34 to 43 year. This is the summary with the Cox regression comparing time to death, return to dialysis and any graft failure by groups. Young adults had a higher non-attendance rate for clinic appointments and more emergency admissions post-transplantation. Limitations: antibody mismatch at transplantation, peak panel-reactive antibody, baseline function, graft age, immunosuppression, pregnancy and disease recurrence are not included. In England, national projects are underway to introduce transition services for young adults to improve the adherence. In summary, data in England show that young adults have substantially worse outcomes for renal transplantation than all other age groups. Young adult support services are likely to be a key intervention in changing this. Kidney Today. Thanks for watching.